Diabetes, also known as diabetes mellitus, is one of the most widespread chronic diseases today and is often referred to as a silent epidemic. Millions of people around the world are living with this condition, many of them without realizing it, because the early symptoms can be vague, subtle, or dismissed as signs of aging or fatigue. At its core, diabetes is a metabolic disorder characterized by chronically high blood glucose levels. This occurs when the body cannot produce enough insulin, or when insulin, the hormone responsible for transporting glucose from the bloodstream into the cells for energy, no longer functions properly. Without adequate insulin activity, glucose accumulates in the bloodstream instead of being absorbed into the body's cells, leading to hyperglycemia. In its early stages, diabetes may cause increased thirst, frequent urination, excessive hunger, fatigue, blurry vision, and slow wound healing. Left unmanaged, the disease can lead to severe complications affecting the cardiovascular system, kidneys, eyes, and nerves, and it significantly increases the risk of heart attack and stroke. This is why blood sugar control is considered the cornerstone of diabetes management and prevention. The encouraging reality is that effective control of blood sugar is not entirely dependent on medication. Scientific evidence shows that adopting a healthier lifestyle, making dietary adjustments, exercising regularly, managing stress, and ensuring adequate rest can all contribute to stabilizing blood glucose levels. For middle-aged and older adults, this approach is especially crucial since medication response may diminish with age and the body's resilience tends to weaken over time. One of the most important lifestyle interventions is regular physical activity. Exercise increases cellular insulin sensitivity, which means the body's cells respond better to insulin and absorb glucose more efficiently. Muscles use glucose as fuel during physical activity, naturally lowering blood sugar levels. Even simple forms of exercise, such as brisk walking for 30 minutes daily, cycling, swimming, yoga, or light strength training, can lead to significant improvements. Beyond controlling glucose, exercise also helps maintain a healthy weight, reduce visceral fat, lower blood pressure, improve cardiovascular function, and boost overall well-being. Dietary management is another cornerstone. Carbohydrates, found in starchy foods and sugars, are the macronutrients most directly responsible for fluctuations in blood glucose. However, not all carbohydrates are created equal. The glycemic index, GI, is a measure of how quickly a food raises blood sugar after consumption. Foods with a high GI, such as white bread, sugary drinks, and processed snacks, cause rapid spikes in blood sugar, which are particularly harmful to diabetics. Conversely, foods with a low GI, such as oats, brown rice, quinoa, lentils, and sweet potatoes, release glucose more slowly, helping to stabilize blood sugar. For this reason, experts recommend prioritizing complex carbohydrates from whole grains, legumes, and vegetables over refined starches. Added sugars and hidden sugars are another challenge. Many people are aware of avoiding cakes, candies, and sodas, but less obvious sources include packaged sauces, flavored yogurts, energy bars, and processed breads. Excess sugar consumption not only raises blood glucose, but also contributes to obesity, fatty liver disease, and cardiovascular complications. Similarly, excessive salt intake is dangerous. Salt raises blood pressure, damages blood vessels, and heightens the risk of stroke, an already elevated risk in diabetic patients. Preparing meals at home gives individuals greater control over sugar and salt intake, making home-cooked meals one of the most effective strategies for blood sugar management. Fiber is an often overlooked but powerful ally in diabetes control. Dietary fiber, especially soluble fiber, slows the absorption of carbohydrates and glucose in the digestive tract, thereby preventing rapid blood sugar spikes. It also promotes satiety, reduces cholesterol, and supports a healthier gut microbiome. Foods rich in fiber include leafy green vegetables, beans, nuts, seeds, and whole grains. Nutrition guidelines generally recommend that women consume about 25 grams of fiber per day, and men about 35 grams, although most people fall short of this target. Increasing fiber intake gradually can improve blood sugar control while also benefiting digestive health. Proper hydration plays a vital role as well. Water supports kidney function, allowing excess glucose to be excreted through urine. Dehydration, on the other hand, concentrates glucose in the bloodstream and can worsen hyperglycemia. For this reason, individuals with diabetes should drink enough water throughout the day and avoid beverages that contribute to sugar intake or artificial sweeteners that may trigger weight gain and insulin resistance. Water, herbal teas without added sugar, and other calorie-free drinks are the best choices. Mental health and emotional well-being also influence blood sugar regulation more than many people realize. Stress activates the body's fight-or-flight response, releasing hormones such as cortisol and adrenaline that stimulate the liver to release stored glucose. In people without diabetes, this temporary surge in blood sugar is usually controlled efficiently by insulin. In those with diabetes, however, this mechanism is disrupted, leading to prolonged hyperglycemia. Stress management techniques, including mindfulness meditation, yoga, deep breathing, walking outdoors, or engaging in creative activities, have been shown to lower blood glucose and improve overall quality of life. Sleep quality is another critical but underestimated factor. Chronic sleep deprivation reduces insulin sensitivity, increases appetite, and promotes weight gain, all of which worsen diabetes risk. Adults are encouraged to aim for 7 to 8 hours of restorative sleep each night. Going to bed and waking up at consistent times, limiting screen time before bed, and creating a calm, dark sleeping environment are practical steps to improve sleep hygiene. In addition to lifestyle adjustments, micronutrients play a supportive role in blood sugar regulation. Magnesium, found in nuts, seeds, leafy greens, and legumes, is involved in hundreds of enzymatic reactions, including those that regulate glucose metabolism. Chromium, present in whole grains, broccoli, and lean meats, enhances insulin's effectiveness by improving the transport of glucose into cells. Deficiencies in either mineral can contribute to impaired glucose tolerance and increased diabetes risk. While dietary intake should always be the first priority, supplements may be beneficial for individuals with clinically diagnosed deficiencies under medical supervision. Recent research has also highlighted the role of the gut microbiome in diabetes. The trillions of microorganisms living in the digestive tract influence metabolism, immune function, and even insulin sensitivity. Probiotics, beneficial bacteria found in yogurt, kefir, kimchi, sauerkraut, and dietary supplements, have been shown to reduce fasting blood glucose, lower hemoglobin A1C levels, and improve insulin sensitivity. Incorporating probiotics into a balanced diet may therefore provide an additional layer of support in diabetes management. Ultimately, the key to diabetes control lies in consistent and holistic self-care. It is not about perfection, but about sustained, small changes that accumulate over time. Monitoring blood sugar regularly, following medical advice, making thoughtful food choices, staying active, reducing stress, sleeping well, and nourishing the body with essential nutrients all contribute to long-term health. For many patients, these measures can delay or reduce the need for medication, prevent complications, and improve quality of life. At the community level, raising awareness about diabetes is equally important. Family members, friends, and society at large should approach this condition with understanding and support rather than stigma. Building environments that encourage healthy eating, regular physical activity, and stress reduction benefits not only those already diagnosed, but also helps prevent new cases. In summary, diabetes is a complex disease, but it is not an inevitable sentence of poor health. With the right combination of knowledge, self-discipline, lifestyle choices, and medical support, people living with diabetes can achieve stability, prevent complications, and live long, fulfilling lives. Blood sugar control is more than just numbers on a glucose meter. It represents comprehensive protection for the heart, kidneys, eyes, nerves, and overall well-being. By embracing a science-backed, lifestyle-focused approach, individuals can take control of their health and build a brighter future free from the burden of diabetes complications.